Hello, my name is Anna Edwards. I am one of the strategy managers at the Care Quality Commission, and today I'm going to talk to you about our new emerging strategy, which we plan to launch this year and will take us from 2021 through the next 3 to 5 years. Specifically today, I'm going to focus on safety, which is one of our strategic themes. So our purpose, as it says on the slide, is even more vital than ever. We were established as an independent regulator with a clear purpose to ensure health and care services provide people with safe, effective, compassionate, high quality care, and to encourage those services to improve. But we need to change how we regulate to ensure that care is improved for everyone. And whilst we'll always be committed to our purpose, the world in which we regulate has changed significantly since we were created. The COVID-19 pandemic has accelerated that change, but new and innovative types of service have been starting up for some time now. New digital channels and new restrictions have changed how services can deliver care. So at CQC, we need to be a lot more flexible than we were before to manage some of the risks and uncertainties that are now present in our health and social care landscape. And we also need to be aware of the fact that services are no longer operating in isolation. And so we as a regulator cannot operate in isolation. We need to be much better at looking at health and care services working as a system and how they're providing care as a system to ensure that people get the best high quality access to the health and care that they need. So in order to meet some of those changes, we've come up with 4 strategic themes. The first is about people and communities. We want to be an advocate for change, and our regulation should be driven by people's experience and what they expect and need from health and care services, rather than how providers want to deliver them. We want people to always feel listened to, understood, and to know how we've acted on what they're telling us. And we want information to help people make decisions about their care, to enable and empower them to drive change. We'll also identify and call out unwarranted variation and inequalities in health and care. The second theme is smarter regulation. We need to keep pace with how health and care is changing. And so we'll regulate in a much more dynamic and flexible way to reflect the future changes that we can anticipate, as well as those that we can't. Collecting and sharing information digitally will also reduce duplication and make it much easier to work with all strategic partners. Using that information will mean that we move away from relying on a set schedule of inspections, and we can target our resources much more effectively, proportionately and efficiently. And we'll also learn and improve ourselves to be more flexible and responsive while still keeping people safe. The third area is safety through learning, and I'm going to come back to that, so I won't talk about it in any great detail here. And the fourth area is accelerating improvement. The support available to help services improve the quality of their care really varies between and within health and care sectors. So we need to do more with what we know to drive improvements across individual services and systems of care. We need to provide a more active leadership role in driving improvement while retaining our core regulatory role. And we should bring health and care partners together to give equal and consistent support to improve quality. We should help services find their own route to improvement, and we'll also expect services to continually improve and drive improvement in their local health and care system. Again, that's something we'll come back to in the safety section. At CQC, we have felt for some time now that there should be a renewed focus on safety And by safety, I mean safety across all sectors and settings. And that focus should really concentrate a lot more on the learning opportunities that exist that we currently don't tap in the way that we could. There are 5 areas in this theme that we think it's important to concentrate on. The first, no one will be surprised about, is the importance of culture. And after many weeks of engagement, what we've concluded is that safety culture really needs to be everybody's job. And that's not just staff working in services, it's people using services, their families and carers. Everybody needs to take ownership of that safety culture and the safety of us as individuals using health and care services. We think it's really important that when people see things that are not good or create risks, or when they see things which are exemplary and really show a good safety practice, that those things are reported open and honestly, and that staff don't feel that they will be blamed or ostracised for raising any concerns that they have. We also think that when staff or family members or anybody else involved in health and care report incidents, that those incidents are used as a really fantastic opportunity to learn and improve. And we think this kind of culture needs to really be a top priority for everyone, regardless of their seniority or their role. As part of the importance of culture, we also think there needs to be a much clearer definition of what we mean by safety. Right now, when we talk about safety in different sectors, people immediately give different definitions of what they think it means. For instance, in hospitals, you might be thinking about medication errors, whereas in the social care sector, you might be thinking much more about safeguarding. And we think in order to really push the importance of culture, we need to somehow come to an agreement across the landscape on what we really mean when we talk about safety. In terms of building expertise, again, this comes back to this notion of having safety as a top priority. And we think that expertise in all services and at all levels needs to be increased so that people understand what each other are talking about when they talk about safety. And those principles should be up-to-date safety concepts based on the most current safety science, so that everybody working in services is able to contribute to the improvement of that service using the knowledge that they have. That desire to build expertise is also something we need to concentrate on at CQC. And we need to build our own knowledge, both within our inspection workforce, but also throughout the rest of the organisation. And that knowledge needs to focus on all those key principles that we know are so important, like human factors and the way that systems work to either improve or create barriers to safety. The third thing that we think is important is involving everybody. We don't think this is the job of national bodies, local bodies, regional bodies. We don't think it's the job of clinicians, chief executives, board members. We think it's everyone's job, including people using services. And we'd like to create environments and support the creation of environments where people using services are much more involved and have a voice in ensuring their own safety. The fourth point there is about regulating safety. So for us, we will be expecting much more that services are learning from incidents that happen. And we need to be able to see the output of that learning to assure ourselves that services have really taken on board incidents that have happened and found ways to try and prevent them happening again. And if we find that services are not going on an improvement journey, or where improvements are made, they're not sustainable, then we will take action to ensure that learning is taken on board and that services can improve over time. And the final point there is about having consistent oversight and support across all sectors. What we've learned in recent weeks and months is that whilst in some sectors there is an enormous amount of support on safety for different providers, in other sectors that doesn't exist. And what that means is that we end up with quite a disparity on how much people can get support from national bodies, on learning, on expertise. And so we'd really like to understand more about what support exists, where the gaps are and whose role it would be to try and fill those gaps. And running through our strategic themes are two really key things that we feel we need to concentrate on. The first is looking at systems. It's really important for health and care systems to work together to deliver care to meet the needs of their local population and the needs of individuals. We can't carry on looking at one service after another in isolation. For us, it's going to become much more important to think about how services work together so that they and we can have a real impact on people's outcomes. We are constantly adapting to this new way of working. And our assessments of people's care in the future will look at every stage of their journey, looking at both individual services and across different providers and organisations. The second core ambition that we have is really to focus in on inequalities. It's not right that some people have better access to safer, high quality care than others. And so we're going to champion the fact that everybody should have access to the same level of care, regardless of their circumstances or characteristics. And this won't happen overnight, so we will need to understand why there is variation that exists and how we can work with others to tackle it. We've learned from the COVID-19 pandemic that inequalities remain a significant issue across different areas of the country and different groups of people. So we need to use the learning from this experience to really enable and progress change. We'd really like to hear what you think of our new strategy, the themes that I've outlined today, and specifically about your views on our ambition for safety. And if you are able to respond, we would urge you to do so by the 4th of March, so that we can really take on board the views of our stakeholders and use those to improve the document, so that when we launch it later this year, it's something that we've worked with our partners on from beginning to end.